Smoking and heart attack is an important association, and smokers have up to 400% greater chance of getting heart disease. The negative impact of smoking on health is so great that it is considered as the most significant preventable cause of disease and death in some countries. Cigarette smoke contains numerous chemicals including nicotine. Nicotine adversely affects the heart and causes buildup of plaques in the blood vessels, decreased amount of oxygen available to the heart and other organs, increased blood pressure, increased tendency for blood clotting. All these increase the risk of heart disease. Decreased amount of oxygen makes it more difficult for the heart to function. Also, with increased blood pressure, the heart has to do more work to pump the same amount of blood. In such a state, if a blood vessel supplying the heart gets blocked, it leads to death of that area of the heart, resulting in a heart attack. The deadly cocktail. Smoking isn't the only risk factor for heart disease. Obesity, sedentary lifestyle, diabetes, high blood pressure are also major risk factors. When smoking is coupled with the other risk factors, they form a deadly cocktail that is truly devastating for the heart. What about passive smoking? Cigarette smoking not only affects smokers but also those who are frequently near smokers. Passive smoking has also been associated with disease of heart and blood vessels. The victims are mainly children of parents who smoke. We all know that passive exposure to smoke is equally, if not worse, than active smoking. Only difference is that the quantum of smoke inhaled is likely to be lesser with passive smoking. This may not be very true in case of small children whose parents smoke. Cotinine is a metabolite of nicotine. An estimation of cotinine levels can be used to assess the level of smoking better than a questionnaire due to obvious errors in individual assessments. Cotinine can be detected even up to a week after smoking. Levels in blood, urine and saliva are proportionate to the level of exposure to tobacco. A study published in the prestigious journal Circulation used cotinine levels to assess the passive smoking levels in children of parents who smoked. The study found that children with higher cotinine levels due to passive smoking of one or both parents had higher chance of plaque deposition in blood vessels of the brain, carotid arteries. The study also documented that children of parents who had good smoking hygiene, not smoking in the vicinity of the child, had lower levels of plaques and undetectable levels of cotinine in blood. The participants were from the cardiovascular risk in young Finns study involving about 2,500 children. It is interesting to note that the blood samples were drawn in early 1980s when the study started, and the cotinine levels were estimated in frozen samples in 2014.